Part of identifying skin conditions is, of course, using reference images to check any spots, lumps or moles. But what if none of the images feature your skin colour?
Yeah, most images currently feature white skin, but one project in Bristol is trying to change that by taking photos of conditions on darker skin to help doctors recognise and diagnose problems on all patients. Cheryl Dennis reports.
This is a photo shoot which could have a big impact on healthcare. The pictures being taken will give doctors and nurses images of medical conditions on skin that isn't white.
I got my nail done because that was a childhood injury. My eye, don't know if you can see it, there's a scar and some stuff here, and my knee with the bumps and a few other bits, but I won't say. They got their pictures out of me today.
There are plenty of images of white patients, but on darker skin, things don't always look the same.
We teach people about the example of, being pale. So we talk about being pale and well perfused, but in white skin, that is obviously very noticeable. But for someone in darker skin tones, you have to, you can't look at the face, for example, so you have to look at the palm of the hand. So you have to kind of approach things slightly differently, compared to somebody with white skin.
In these medical books, the team have found that only 5% of pictures show black or brown skin. It's a project being supported by the NHS. They hope to create a free library of pictures which can be used all over the country.
It's a really important project to help to reduce health inequalities. That's really the biggest aim of this project. The images will be verified as well, so clinicians looking at them will know that if it says it's a measles rash, it'll be a measles rash and not something else.
It's the first of 30 sessions, and all the photos will be anonymous.
I've got a fistula, which is a joint of veins, so that I can have my dialysis, which is for kidney failure. It's important because obviously the people who are doing the treatment come from all over the world, and they may have the experience of those diseases, those complaints, and they're not recognised when people with darker skin present themselves here.
I've just gone through a medical book here that they've shown. It does need changing. Our doctors need to be given the right tools to do their job even better, even more robustly. And this will help, and I'm really excited by it, actually.
All those here hope they're making an important contribution to the NHS, one which caters for every patient from every background. Cheryl Dennis, BBC News.
Well, joining us this morning is consultant dermatologist Dr. Tamara Griffiths from the British Skin Foundation. A very good morning to you. Charlie and I both said this morning it's surprising that here we are in 2024 with ethnic minorities underrepresented in these images.
It is definitely a problem that we recognise, and we are doing many things to try to promote providing good skin care and information for our entire patient population. What I find really encouraging is a lot of these initiatives are actually driven by medical students, so future doctors, which I think is very promising. But it is a legacy of, medicine in general, that we need to be much more inclusive and improve access of healthcare to all of our patients.
I'm trying to work out how this is worrying in practice. So you've got a doctor who sees a patient, who doesn't instantly know, can't immediately diagnose, and they want to go to they want to reference it somewhere. What happened? Wherein lies the risk here?
Well, we know that skin cancer particularly is much more common in white skin. So we associate melanoma, which is a very dangerous, potentially dangerous type of skin cancer, with fair skin that always sunburns, never tans, freckly skin. And the incidence in white skin for malignant melanoma is about 25 to 26 per 100,000. So it is much more common in fair-complected people. And that patient population is aware they need to protect themselves from the skin and not burn. But malignant melanoma also occurs in more darkly pigmented skin at an incidence of about 1 to 5 per 100,000, so it is much less common, but it does occur. And the problem is we know that melanoma, which has been diagnosed in more darkly pigmented skin or the ethnic minorities, tends to have a worse prognosis and worse outcomes because it's picked up later.
Yeah, you're a dermatologist yourself, so have you actually been in that situation where you're faced with a condition and you're looking for somewhere where you could reference it with other images from other studies or whatever, and you just struggle to find anything to reference it with?
I think as a specialist dermatologist, we are aware of the broad range of diagnoses in all skin types, but really it's at the interaction at GP level or in primary care where it may not be a specialist, so they're much less aware and they reference images. So I would like to say, dermatology is a very complex specialty. There's more than 4,000 diagnoses, and dermatology is not reduced to looking at a picture and making a diagnosis.
Sure.
As with any aspect of clinical medicine, it's taking a thorough history, thorough physical examination, which will lead to an accurate diagnosis and appropriate management. But certainly at that primary care interface or that student level, images are beneficial. So definitely important. It's important to raise awareness amongst patient population as well as healthcare professionals.
Well, I was going to say, is it necessarily about those images on its own, or is there a chance that people who may develop something on their skin or go to a GP and they don't have white skin think it's probably not that because we are 25 times less likely for it to be skin cancer? So that self-referral is reduced.
I think all those factors play a role. So I would really like to emphasize how patients at home, maybe who have darker skin types, can check their own skin and be aware. So melanoma in darker skin types tends to occur in locations such as the palms and soles, so the soles of the feet, the palms, under the nails, the toenails and fingernails.
So what exactly would we be looking for?
So a similar sort of thing, so a pigmented, a brown lesion or a black lesion, which is changing, which is asymmetrical, not a mirror image of itself, irregular borders, scalloped or notched borders, blotchy color. Those are the sort of things that are red flags for melanoma. But patients often don't check the soles of their feet, or if they have a toenail, they might think it's just trauma-related. And in addition, it's also the mucosal surfaces, so the inside of the mouth and even the private areas, which people might not examine. So those are sites that I would like to raise awareness for individuals to check themselves, and also for, obviously, healthcare professionals to be aware those are the more common sites for malignant melanoma.
Do you know, it's very interesting listening to you, because I didn't know a lot of what you've just said about the soles of the feet, for example. People really do need to wise up. Are they good places to get information?
Well, certainly there are websites. The British Skin Foundation has a fantastic website, as does the British Association of Dermatologists. I'd also like to talk about another type of skin cancer called squamous cell carcinoma. So we have melanoma skin cancer and non-melanoma skin cancer. And squamous cell carcinoma can also be impacted by lifestyle. Yes, primarily UV light, but also by smoking, tobacco, and chewing tobacco, as well as the HPV, the human papillomavirus. So those are other risk factors for a type of skin cancer called squamous cell skin cancer that people need to be aware of and may have control over in terms of altering their lifestyle, in addition to good sun protection.
Very interesting talking to you this morning. Thank you so much. That's Dr. Tamara Griffiths, who's from the British Skin Foundation. Thank you.
Lovely to meet you.
And I love that it's been driven by young medics who've identified this problem and said there aren't enough of these images out there. That's
very
fantastic.
promising for the future.
Isn't it? Thank you.